Well, I want to thank you, Governor Ismail, for taking the time to meet with me. I apologize for not being there in person, but given some of the recent events in the Middle East, my university and also my wife felt it'd be safe for me to be at home, at least during this initial visit. My name's Ken Moise. I'm a professor of OBGYN and pediatric surgery at the McGovern School of Medicine in Houston, Texas. I also am part of the fetal center at Children's Memorial Hermann Hospital in Houston, Texas. I'm excited to talk to you today about a potential project in Pakistan that I think will have a major impact on the health of women and children. In the United States, about 85% of individuals are Rh positive. And on their red blood cells in their bloodstream, they have a protein called the D antigen that makes them positive. And about 15% are Rh negative. That means they lack this D antigen. Turns out in Pakistan, about 83% of people are Rh positive and 17% are Rh negative. That's relatively new data from a small project done by Lisa Pell of Toronto Sikh Children's Hospital in the Dadu district of Pakistan. Originally, the literature would suggest that the rate of Rh negativity was much lower in Pakistan at 7.5%, but turns out it's much higher than expected. What happens in this disease is if an Rh negative woman carries an Rh positive fetus, so that's a fetus who inherits its blood type from its father, and at the time of delivery, typically some of these blood cells get into mom's circulation, then she'll recognize those as being different from her blood type, and she'll develop what's called antibodies, which are another type of protein, to defend herself, if you would, to attack these red cells. This first pregnancy causes the problem, but it's the next pregnancy, if she carries another Rh positive fetus, that suffers the consequences when these antibodies cross through the placenta and attach to the baby's red blood cells inside the baby while it's developing. And we call the disease that occurs in the baby hemolytic disease of the fetus and the newborn. So that's with these antibodies in the mother that can cross over and cause fetal anemia or a low blood count. And in the worst case scenario, the fetus can develop heart failure. This is called hydrops fetalis, and this can result in even fetal death. So this is a devastating disease. Once these antibodies form, they never go away in a woman's life. And as a general rule, each pregnancy is affected in a worse way than the previous pregnancy. In the United States, Rh negative women back in the 1960s, about 1 in 167 of their pregnancies were affected by this disease. But in 1968, two scientists in Columbia University in New York developed a shot called rhesus immune globulin that can be given at the time of delivery that is about 98% effective. And what you can see is that once this was introduced in the United States, the incidence of disease fell dramatically to where we no longer record statistics since 1990. And this is true in most Western countries, Europe and Canada. It's a pretty simple shot. It has to be given at every delivery. It's not a vaccine, so the effect wears off, if you would. But when it's given in the proper amount at the right time after delivery, it's 98% effective in preventing these women from developing these harmful antibodies and hurting their future pregnancies. There's a paper published in 2011 from a group in Canada looking at what the burden of disease would be in Pakistan. And if this is using 2008 UNICEF data, if there's about 5 million births in Pakistan at the time, and using the old statistic of 7.5% of the women being Rh negative, puts a lot of pregnancies at risk. These investigators had access to sales data on how many units of rhesus immune globulin were sold to Pakistan during that time. And in each year, that would mean that almost 250,000 women don't get treated in Pakistan, resulting in about 17,000 pregnancies and babies affected by this. If you use the new number of 17% rate of Rh negativity, you can see the numbers are dramatically higher. And in this case, they're as high as almost 60,000 babies born each year with some effects of this terrible disease. This is hydrops fetalis. So you can see the very swollen belly and thickened skin of this baby. This baby died. This is actually in the United States, but this baby died of hydrops fetalis. And in the pilot project in the Dadu district, now including about 1,600 women, there were 17 stillbirths and 27 neonatal deaths. Now, we're not sure if all of these were due to Rh disease, but clearly some of them were. And when you look at Pakistan as a whole, and you look at the 2016 WHO statistics, Pakistan has the highest stillbirth rate in the world that's been reported, and clearly some of this is related to Rh disease, which is totally preventable, as we mentioned. It turns out, and this was proven in the pilot project done by Sick Children's in the Dadu district, that you can do sort of bedside testing in the field with these little cards. This is a Eldon card where you can put a drop of blood on the cards and determine whether the patient is got a D negative or D positive blood type. They proved that they could teach healthcare workers to do this very accurately. So the patient didn't have to have blood drawn. It could just be a drop of blood. And they even developed an app on an iPhone for determining these results. So they proved that they could very accurately in the field determine a pregnant woman's blood type. So what we're proposing and exploring, and we have the support of Dr. Salim Khan and the Khan Foundation, as well as Dr. Farhan Isa of the Isa Laboratories of Pakistan, to consider this project, is to first and most importantly create a prophylaxis study of Rh negative women in their first pregnancy. We know we picked the first pregnancy because we know they won't have any antibodies, never having been pregnant. And we would give them this shot of rhesus immune globulin at delivery, which we said was 98% effective in preventing any future disease. In women who have had pregnancies, we'd want to figure out a way to screen them for antibodies to see if they developed them in a previous pregnancy. If they didn't, they again would get their shot of rhesus immune globulin. But if antibodies were present, we would like to establish at one of the local hospitals, we're not sure which one yet, a way to treat this disease. There are some very effective treatments that can be given to these very sick babies. It requires some high technology, but we would like to include that. So I thank you for your time. I apologize again for not being there in person, but I hope this sort of introduces the concept of what we're interested in, and we're very excited to help with this project in your country and hopefully make a big impact on the rate of stillbirth. But thank you very much for that. And we appreciate the opportunity to do this.